So abortions in the second trimester and beyond, which are exceptionally rare, and make up less than 10% of all abortions that take place in the United States, can be done in one of two ways. One is an induction abortion, which is similar to a labor induction, having a vaginal birth. And then the other is through a dilation and extraction or evacuation procedure, which is a surgical procedure. In the induction process, above viability and the circumstances in which those abortions take place, almost exclusively all providers will administer a feticidal injection ahead of time. So they will inject something into the pregnancy or the fetus to stop the heartbeat prior to the induction taking place, so that the fetus dies on the inside prior to being delivered. In a dilation and evacuation, the medical surgical procedure, oftentimes what happens is the umbilical cord is clamped and transected prior to the procedure starting. So again, effectively stopping the heartbeat of the fetus before any further action is taken. There are some regulations in that, and I don't know if Bryn has some about the Partial Birth Abortion Act, which is from U.S. Constitution, or not Constitution, sorry.
It's a congressional act.
Congressional act, which has specific stipulations that requires that we all abide by that, so that the scenario that you're describing, where a fetus may be born partially alive, does not take place, and then exterminated would not take place. And so there are very specific guidelines that we all follow in our clinical practices to ensure that that does not happen.